Hi friends, this is Dr. Abdequaem Chimthanawala. Today let us deal with some skin symptoms of THUJA occidentalis. Now THUJA has got so many skin symptoms in our mathematic and repertory. I will deal with only those symptoms that I have seen in my clinical practice and confirmed in many of patients, and then I am speaking in front of you. The main symptom of THUJA, of course there are so many symptoms, but that we all know that eruptions on covered parts. Whichever the part is covered, the eruption, that is THUJA. Now, whenever you have these symptoms, that eruptions on covered part of the body, we normally give THUJA only. But it is very important to understand that at least one comparative remedy you must have, and that is a very interesting remedy, rarely thought of. Think about Ledampal. So whenever there is eruptions on covered parts of the body, think about THUJA and Ledampal. And in THUJA, one more symptom is important: eruptions on perspiring parts. Means wherever there is perspiration, the eruption comes. Patient बहुत बार बोलता है कि डॉक्टर साहब मुझे पसीना आता है ना, वहाँ खुजली आती है, पसीना आता है ना तो फोड़े आ जाते हैं. So eruptions on perspiring part is a very important symptom of THUJA. And again, I would say, do compare this with your mathematical remedies like CPI is there, Lyco is there, Nitramur is there, Rustox is also there. In fact, THUJA, CPI and Rustox have to be thought very closely, because these remedies have a very important and close symptom of eruptions on perspiring part. In THUJA, one more symptom is very important, that is eruptions, cold bathing aggravates. पेशेंट बोलते जब भी मैं ठंडे पानी से नहाता हूँ तो मेरे को खुजली आती है और चट्टे आ जाते हैं और इरप्शंस आ जाते हैं, एंड दैट इज अगेन अ वेरी वेरी इंपॉर्टेंट. इन फैक्ट द एंट्री पॉइंट इज दैट इन लॉट मेनी ऑफ केसेस आई हैव सीन दैट eruptions generally on cold bathing. Now whenever we have eruptions on cold bathing, one remedy you should always remember, and that is antim crude. That's why as THUJA is a polycrust remedy, there are a lot of symptoms you have to compare with the remedy, so that your mathematica is what you call wide, and the application is very easy to the patient. Now one more symptom in THUJA is, of course, if it's a female patient, generally menses aggravates. In fact, during menses, if the eruptions are, or in fact it is not eruptions, if you go to see some more important symptom, coldness of skin. Patient comes and tells you, लेडी दैट मुझे ऐसी स्किन बहुत ठंडी लगती, पता है पीरियड्स आने के पीरियड्स के दौरान. मीन्स there is coldness during menses, and this is again a very very important symptom. Whenever you have a case and the lady has this type of symptom, do think about THUJA. But more important, you must be surprised that you do compare this coldness of skin during menses with Ledampal. And so I told you, Ledampal, how it is important. Eruptions on covered part, coldness of skin during menses is THUJA, Ledampal. In fact, Ledampal we never think about in skin complaints, but it is such an important comparative remedy with THUJA. Next, we have cicatrices. Cicatrices which are blue, or cicatrices which are painful and the pain is stitching in nature, that is in THUJA. So whenever you see the cicatrices are blue, do think about sepia and antim crude. Very very important. And cicatrices which are painful, again, that's also silicea. As we go further, as I told you, the cold aggravation, one thing is more important in THUJA is that eruptions which are painful and burning after washing. Burning after washing in cold water. So whenever you have eruptions and there's burning and the patient washes that with cold water, it aggravates. It is painful eruptions, and that is a very very important and a very very important PQRS symptom of THUJA. That is painful eruptions, burning eruptions after washing with cold water. Do remember this symptom in THUJA. Next, we have THUJA is a very very interesting and important remedy for molluscum contagiosum. A lot of people ask me in my YouTube live about molluscum contagiosum. I have shared some remedy, but THUJA is a very very important remedy. Lot of cases of molluscum contagiosum have good results with THUJA. Again, do compare molluscum contagiosum with THUJA, sulfur, silicea. These three remedies have given me very good results. Of course, other remedies like Lycopodium, Nitramur are also there. Next symptom, where the excrescences and or the condylomata are very horny, it is THUJA. When the excrescences and condylomata are itching, that is THUJA. See, whenever the condylomata are itching, do think about THUJA. Do think about, I think Staphylococcus aureus is there, and Lycopodium is also there. But THUJA is also there. And I have seen in THUJA, the excrescences of condylomata split. Split, that is THUJA. and that is lycopodium. So whenever you have these type of symptom, comparative mathematica will give you a different view of the patient and the remedy. Next, you see in THUJA, a very common symptom that we all know is that hair on unusual part of the body. मतलब जहाँ बाल नहीं होने चाहिए वहाँ भी hair रहते हैं. It could be on the sometimes on the cheeks, right below the ear, or the forehead, or the sometimes dorsum of the hair, or a lot of hair in the back and all, which should not be there. So THUJA is a very important remedy. One more remedy that I have seen in my practice is lycopodium. So THUJA, lycopodium, again a very important remedy. Of course, many of skin symptoms of THUJA, but I am dealing only the important ones which I have seen in my practice. Now warts of THUJA could be taken, the whole one lecture would be on warts of THUJA, but I'll deal only few warts which I have seen many ample of times in my practice and prescribed THUJA. First thing you have to remember, in THUJA, warts in young girls. Whenever you find warts not resolving and if it's a young girl, think about THUJA, think about sepia, think about sulfur. Warts in young girls are these three remedies are very important. In THUJA, what I've seen, okay, cauliflower-like wart and a lot of things were wart, but in THUJA, warts fissured warts, a very important symptom of THUJA warts. Whenever you see the fissured warts, you're confused what to give, think about THUJA. One more thing about THUJA warts is the warts are very dark in color. बहुत dark रहते THUJA के warts, very similar to sepia. In fact, dark warts and warts are very rough. Seed warts it is called, rough and seed warts is also THUJA and sepia. अब जब हम देखते हैं warts THUJA का, तो if you see warts of THUJA, one or two symptoms are important. In THUJA warts, when you touch the wart, it is painful. So, or you can say it is not painful, it is very sensitive. So, which are warts which are very sensitive to touch, do think about THUJA, and sensitive warts, do think about Staphysaceae and causticum also. Very important remedies. THUJA, Staphysaceae and causticum. Sensitivity of warts is very high. Of course, nitramur is also there, but of a lesser degree of importance. One more symptom that crosses my mind about THUJA warts is what suppressed elements from. मतलब जब भी हम वॉट सप्रेस्ड करेंगे और उसके बाद सिम्टम्स हटे, डू थिंक अबाउट THUJA, suppressed warts elements from THUJA, and one more remedy, Staphysaceae. These two are very important. Of course, there are other remedies also, but these two I have seen a lot in my practice. So my dear friends, very important symptoms of THUJA skin, very minimal symptoms I have taken in this YouTube video so that you are able to understand THUJA in a better way. If you like this video, my dear friends, do share and subscribe. Thank you.